My name is Hasson. I'm an orthopedic surgeon specializing in hip and knee replacements here in Orange County, and I work at Restore Orthopedics. I'm here today to talk a little bit about my practice and what I do, as well as about why I use the Stryker Mako robot for all my knees and all my hips. A lot of patients come into clinic and they don't know whether or not they really need a knee or really need a hip replacement, but they've been sent to me by a friend, a family member, or their primary care physician, and it's my job to educate them on what we're looking at on their radiographs, what we're seeing with their history, how their pain or their limitations on motion is affecting their daily life. And so today we're going to talk a little bit about the robot. I initially came out here and I wasn't planning on using the robot, but it just happened by chance that I started using it on my hips initially, and then I transitioned all my knees over to the robot because I really think it is a game changer. For the hip and the knee, we always get a CT scan preoperatively, and that's to allow us to plan out your surgery beforehand. We can measure the varus valgus of how we align your knee. We can cut your tibial slope exactly how we want it. And on the hips, it's really important because we get a 3D model of your pelvis, and we get to really understand your anatomy, because every patient's anatomy is different. A lot of people have had spine surgery or previous pelvic trauma, and this can affect when you have a hip replacement. So having a 3D model and being able to plan the surgery beforehand allows us to plan it ahead of time so nothing unexpected happens during surgery. So with the CT scan of the pelvis, I find myself putting in a little bit smaller cups than I normally would have before, because with the Stryker Mako computer robotic arm and planning the surgery, I'm finding that I'm having better acetabular bone conservation, meaning I'm not taking as much bone before. I'm able to template to the exact size that's appropriate for your cup, which we call the acetabulum, and by doing it under the arm, I can take as much or little bone as I want. This has helped me have better stability with my cups. Before I was using screws. With the reaming of this, I'm getting better purchase in the socket, your acetabulum, and I don't need any screws. I'm able to more appropriately version or place the cup in the right position based off of your anatomy and if you've had previous lumbopelvic fixation. As far as on the femoral side, it allows me to plan my stem size so there's no guessing, and I have a better idea of what size I'm going to need. And then also, and we'll show you this on the software, we're able to predict what your leg length discrepancy was before surgery, and then match it up with the use of the robot and the software intraoperatively so that your leg lengths are equal after surgery. In regards to the knees, a total knee, while it is a bony procedure, in my eyes it really is a soft tissue procedure. With the advent of total knees, it operates on a haptic, and so this saw blade is limited in how far it can extrude to one side or the other. And so this allows us to be more soft tissue friendly. Our incisions don't have to be as big. With less soft tissue injury or trauma, that leads to less pain post-operatively, earlier, better range of motion, and more importantly, a happier patient. We can also appropriately balance it. Before, you would take the leg in your hand and you kind of have to feel through experience of saying, okay, this opens up this much and this opens up this much medially and laterally. But with the robot now, because of the arrays that are put on the body, they can tell you exactly how many millimeters it's opening on the outside and on the inside of your knee, and tell you whether or not it's balanced and what your gaps are in both full extension when your leg is straight and then flexion when your knee is bent.